to this channel. My name is Debbie Kiboma.
And my name is Benta.
This is Dr. VYAS.
And today, guys, our topic today is about high blood pressure emergencies. Stay tuned and let Dr. Bharath go through it.
Blood pressure emergency is basically stage 4 hypertension. Blood pressure based on the values it is divided into various stages.
Yes.
Stage 4 hypertension is any pressure where the systolic pressure is above 180 and diastolic pressure is above 90.
Okay.
And if the pressure is only that much, we call it hypertensive urgency. But along with this blood pressure, if there is any target organ damage, target organs are brain, heart, kidneys, eyes. These are all the target organs which can get damaged by high blood pressure. Okay. If any one of these target organs are involved or damaged, like in the case of brain, a patient has whether it be hemorrhagic or ischemic. Hemorrhagic means bleeding in the brain.
Yeah.
Okay.
This high blood pressure usually results in bleeding in the brain because of the rupture of berry aneurysms.
Yes.
Or it can also cause heart attack. Okay.
Yes.
It can also cause kidney failure. It can also cause retinal detachment. Okay. When any of the target organs if they are involved, then we call it blood pressure emergency.
Okay.
Hypertensive emergency.
Okay.
If the target organ damage is not there, we call it hypertensive urgency. Because this urgency can evolve into emergency very fast.
Okay.
Yeah.
Our viewers might want to know in which situation does someone have high blood pressure and what is high blood pressure itself?
Our normal blood pressure is 120 by 80.
Yeah.
But from 100 to 135 is the range.
Okay.
That is the systolic pressure. And diastolic pressure, it can be as low as 70 also. 70 to 85 we take normal range of the blood pressure. But usually we define normal blood pressure as 120 by 80. It's a general knowledge thing.
Okay.
Anything above 135 by 85, we define it as blood pressure. A person having constantly above 135 by 85 values in the blood pressure, we call them hypertensive. And they are the persons who require treatment or lifestyle modification based on the symptoms and also the history.
Okay, and to our viewers, the doctors said about systolic and diastolic functions. You hear your doctor saying about 120 over 80, two numbers. So the first number is the systolic and the second number is the diastolic. Okay,
Yeah.
thank you.
So they need to understand actually what is systolic and what is
what
diastolic.
Yeah.
Systolic means the pressure in the blood vessels,
Yeah.
especially the arteries,
Yeah.
when the heart is contracting. Okay.
Okay.
And the diastolic is the pressure in the blood vessels when the heart is relaxing.
Okay. And those are the two numbers.
Yeah.
Okay.
Let's say, for example, you are at home and you feel that your high blood pressure is high. What are you supposed to do? Are you supposed to lick some sugar or
No,
when
no,
it's
nothing
high?
like that. When blood pressure is high, first of all, try to relax.
Okay.
Okay. Most of the time, blood pressure becomes high because of the anxiety. Yeah. Most of the time, it is because of the anxiety and stress caused by various things.
And how could you tell? Debbie has said like you are at home and you feel your high blood pressure is high. How could you tell which symptoms are the simpler to say that my pressures are high before testing?
Usually, patients with high blood pressure, they come with the symptoms of headache.
Yeah.
Okay, headache that is unrelenting. Despite taking rest, they will have persistent headache. And second thing is that they feel the head is heavy. They feel palpitations. They feel anxiety. Anxiety causes blood pressure, and again, blood pressure itself can result in anxiety.
Okay.
And people with high blood pressure, they tend to be, very irritable.
Okay.
They always shout at other
angry
people.
so quickly.
Yeah, they get angry very easily. Even small things irritate them, and they shout at people. So these are the symptoms. But unfortunately, the problem with blood pressure, especially in Kenya, is that symptoms are very minimal. Till the blood pressure goes above 180 by 90, 200 by 110, many people they don't show much symptoms.
Okay, so when it goes that high, that is what today we're talking about, the high blood pressure emergencies. What are those symptoms? Like now it has gone to 180 over 110.
Yeah, basically if it is an emergency,
Yeah.
patient will have any of these things, like symptoms of stroke. Okay, the patient suddenly becomes unconscious or may develop seizures. After that, the patient can even develop one-sided weakness. So these are the symptoms of brain. As far as the myocardial infarction, that is the heart involvement is concerned, the patient can have chest pain that is radiating to the left shoulder and the hand. Okay, and crushing pain. The pain is critically pain is described as crushing pain. The patient will not show pain like this in heart attack. Patient will show pain like this, as if some stone is put on the
It's being
chest.
pressed.
Yeah.
Okay.
So that kind of pain patient complains of. And as far as kidneys are concerned, the kidney damage happens because of the blood pressure. Usually it is a long-term thing, and patient will develop vomiting. Patient will have difficulty in, not difficulty, patient will not pass urine as much as he is supposed to pass.
Okay.
Patient can develop swelling of the feet, and there can also be palpitations. Okay.
Yes.
Yeah, that is about the kidneys. And as far as the retinal damage is concerned, usually retinal detachment happens when the pressures are so high.
Yeah.
And this retinal detachment is a medical emergency because the retina gets detached from the posterior wall of the eyeball.
Those are now the symptoms of an emergency. And in all cases, we know that when an emergency happens, you need to like act on it. So is it necessary when that happens to see a doctor or a nurse, or there is a remedy to be done back at home?
Remedy, there is no remedy. But blood pressure emergencies, they have to be attended by a doctor immediately.
Okay.
Thing is that at least diagnosing hypertensive urgency is better than dealing with the emergency. Because by the time emergency happens, there may not be anything more that we can do many a times.
Yeah.
The damage may be permanent many of the times.
Does a patient need tests?
Yes, patient needs testing, okay, especially blood hypertensive urgency and hypertensive emergency patients. In emergency, we target whatever the emergency, whatever the complication, whatever the target organ that is damaged, we check for that. In urgencies, we try to find out why the person's pressure is like that. Is it innately like there is something called essential hypertension, which means that it's a primary form of hypertension happened due to genetic reason. Many of the times the patient's cholesterol is high, patient has a very bad lifestyle like drinking, smoking and very stressful activities. Okay, these all things, and obesity.
Yes.
These are all the main causes of blood pressure.
So the tests are usually useful when that emergency has occurred. We know from the emergency, the symptoms at home, it's an emergency, they have come to the doctor. Do you do all the tests?
Yes, we do all the tests. It is imperative that we do all the tests.
Okay.
For example, if the kidney damage, if it is recognized early, it can be preventable.
Okay.
Same thing happens to the heart also.
Okay.
If we see ischemic changes in the heart, okay, we can prevent infarctions in the future. Okay, ischemia is low blood supply, infarction is total lack of blood supply and the tissue dying. Okay, so diagnose ischemia, it is reversible many a times. The same thing happens to eyes also. We even check eyes. We do fundoscopy. We see for hypertensive retinopathy.
Okay.
Hypertensive retinopathy in grade 1, grade 2 is treatable. After that, it's not treatable. The only thing we can do is laser photocoagulation. Okay, and detachment, once it happens, unfortunately, the treatment options in Kenya are very, very limited.
Okay.
In countries like India and USA, retinal detachment is also being repaired effectively. But unfortunately in Kenya, the facilities are not there. Second thing is that it's a time sensitive thing. Retinal detachment, when it happens, it has to be treated quickly.
Okay.
It has to be repaired quickly. Otherwise the person may lose the sight.
Okay.
That means the person might go blind.
Yeah.
And the emergency is treated, like is the high blood pressure emergency treated?
Emergency that they are treated. Na?
Can they like go back to a normal life or?
We try our level best. See, for example, if a person has already got heart attack,
Yeah.
if the patient is brought within 6 hours, that is called the golden period, patient can be thrombolized and it is possible to restore the cardiac function. Okay, but what happens is in Kenya, most of the time people who get heart attack, they die on the way only, or they are brought in a very bad situation where the heart damage has become too much to save the person. Okay. The same thing happens in strokes also. Stroke patient within 3 hours, if he is brought to the hospital, if it is ischemic stroke, it can be thrombolized.
Okay.
Hemorrhagic strokes are not difficult to treat. Thing is that the technology is not available. Hemorrhagic means bleeding, stroke happening because of the bleeding. The technology is not there because we need to do coiling. Unfortunately, in the place where we are living, there is no neurosurgeon.
Yeah. Okay.
Even if there is a neurosurgeon, interventional facilities are absent in many places in Kenya.
Okay.
But ischemic stroke happening, it can be thrombolized at our center also.
Okay.
Yeah.
Before we finish the video, what's the last thing that you can tell our viewers about high blood pressure?
What I advise is, in my practice, what I have seen, when compared to countries with the same socio-economic standards, in Kenya, the occurrence of blood pressure is very high, and especially in Kisii. And people are becoming hypertensive very early here in Kisii. Not only in Kisii, in the entire country. See, the average age of onset of blood pressure in many countries is around 40 to 42 years. Okay, in Kenya we are seeing hypertensives with very young people, like 30-35 years also, especially in women, maybe because of the eclampsia, high incidence of eclampsia. By 30 years, women are becoming hypertensive here, and men by 35 years they are becoming hypertensive. Okay, and second thing is that 50% of the patients above the age of 50 are all hypertensive. In my estimate, I think, in my guess, I think not 50%, it is more than 50%. I expect it to be as high as 65% if everybody is screened. Unfortunately, people come at a very late stage, like when the pressure is around 210. Many a times I see patients with pressures 210, and I never saw that when I was practicing in India or other countries. Like I practiced in other countries also, so I didn't see that in other countries. But in Kenya, 210 is like many patients. In fact, I think more than 50% of the newly diagnosed hypertensives, I saw pressures as high as 210.
Okay. I think we all want to know why young people are getting hyper. And if you want to learn more about diabetes, you'll have to watch this channel. Yeah, right?
Diabetes and pressure, that is.
Yeah. Okay, this marks the end of this video. Thank you for clicking again, and let's meet next time. Remember to subscribe, like, and share to your friends. Bye.
Thank you.